Hello. In this lesson, we will explore healthcare system. So technically, we're going to be looking at the introduction of healthcare system around the whole world, and specifically on some countries that actually develop the healthcare system to be able to be very inclusive of all the citizens in the society. Now, we're going to look at healthcare system, how healthcare system are being planned based on the factors that make up a healthcare system, starting from planning. Planning is key in pretty much everything you do in healthcare, because healthcare is a very sensitive aspect of management. That means it has to be pre-planned before implementation. Now, organizing is very important. Organizing deals with human resource management, managing both humans and material resources to be able to make sure that your costs are very efficient and you're able to be inclusive in your healthcare delivery. And now, lastly, the third factor about healthcare system is financing. Finance is very crucial. Pretty much, healthcare system cannot be rolled out if adequate finance is not being injected into the system. So these three factors make up what we call a healthcare system. The first one, again, being planning, organizing, and financing. The goal is to enhance the health of a population efficiently, making it very inclusive and ensuring that everyone in a society or in a population are able to get healthcare services as much as possible. Citizens can choose from different healthcare systems. This is also making sure there are various healthcare systems available for different class of people in a society. And moving on, types of healthcare facilities out there. We're going to start from the United States again. Now, the United States has different healthcare institutions and systems. They do have what is called nursing home, which provides 24/7 healthcare services, especially for those with chronic ailments, and those who are retired and those who actually need help. What we call the Americans call the senior citizens. The nursing homes provide 24-hour support. They've got nurses and nursing assistants. Like I said earlier, I used to manage a long-term patient hospital back in Minnesota for 6 years. So I really understand the structures that exist when it comes to nursing homes, or what we call the group homes back in America. We also have doctors' offices focused, which kind of are very specific on one kind of medication, like the GPs, the general practitioners, or dentists. So they are particular and specific on specific type of medicine. We also have the walk-in clinics, which offer immediate outpatient hospitals, especially if you are needing to get immediate healthcare service without any appointment. You can walk into a clinic and get that before you can schedule to see your primary physician. We also have the ambulatory surgical centers that are well designed to provide surgical services for a little bit more complex healthcare system or healthcare problem. Moving on, type of healthcare, again, we have hospitals that provide both short-term care for people with severe health issues resulting from injury, diseases, or genetic anomaly. So there are several systems of healthcare in America that are designed to be able to take care of different kinds of people in America. All right, let's look at the systems again based on the structures that are being implemented there in the countries. We have the primary healthcare that takes care of really the primary system and the primary sicknesses that a patient suffers. We also have the secondary healthcare centers that deal with referrals. All right, if you're having a problem, for instance, I went to a dentist one time, and the dentists do not have the tooth extraction. They don't have the tooth extraction system in that dental clinic. They had to refer me to a secondary center where I can get the surgery. So that is what we call the secondary healthcare centers that deal a lot with referrals from other physicians. We also have the tertiary healthcare centers that deal with a lot more complex healthcare services like surgeries and other very complex healthcare services. Now, there are also the basic healthcare units. We have the district level healthcare centers that exist in several nations of the earth. Now, there are characteristics of healthcare systems. Like I said earlier, financing is very crucial, access and delivery. It has to be accessible to pretty much all the patients. Payment, expenditure, and cost control and resources. If you want to be a good healthcare manager, these 5 components you have to be mindful of managing these 5 health components: financing, access and delivery, payment, expenditure, and cost control and resources. And continue, finance is very crucial. We talked about it before, that it is one of the most crucial aspects of healthcare. Medicare and Medicaid program play an important role in public healthcare financing. Focus is to provide assistance to the poor and the senior citizens. Now, access and delivery, we talked about it before. There has to be access to healthcare to all and sundry, and also very important that there are very good structure put in place in terms of delivery. Now, payment is very important. There are several kinds of payment of healthcare deliveries. Now, in some countries, there are insurance, and some actually pay out of pocket. Payment of hospital service is very crucial for continuity. All right, and expenditure and cost control. Centralized funded countries establish a tight control over acquisition and resources. Centralized system provide greater equity and facility distribution. Acquisition is one of the things that actually make the price go up or down, because when healthcare system is acquired, that means it is privatized. So most times there are rules of acquisition when it comes to healthcare facilities. All right, let's move on to the future ahead. Countries should actually be focusing on better cost containment strategy, trying to minimize the cost of production or the cost of service to ensure that continuity, and also to ensure that there is a little bit of profit maximization, but that's not the key. The key is to ensure that those who work in healthcare are well taken care of, and cost-effective mechanisms should also be put in place to make sure that the prices are lowered, cost is lower, and the revenue is up there. Balance is required between individual needs and societal needs. In summary, healthcare systems are designed to deliver healthcare services. Healthcare systems are characterized by finance, resources, access, and expenditure. Thank you.